Hi everyone, and welcome back to our next episode. As a reminder, my name is Alejandra, but I go by Ale, and it's great to see you back. Today we are going to have a great conversation, and to start off, I'd like to welcome both of you here to our space and to allow you all to introduce yourselves to our audience.
Thank you so much, Alejandra, for having us. My name is Noemir Mendaris. I'm a program coordinator for Texas Tech Psychiatry in the Division of Child Psychiatry.
Thank you.
And I'm Sarah Martin, and I am a child psychiatrist, child and adolescent psychiatrist at Texas Tech. I'm the chief of the Division of Child Psychiatry there, and we do a lot of programs where we work with other medical schools around the state to provide coverage for the whole state in certain areas of child and adolescent psychiatry.
Well, thank you all so much. It sounds like you all have a very extensive and admirable professional experience. So again, thank you all so much for being here. And I think how I would like to start off this conversation is to know, how are both of your efforts? I understand you all are working in the same institution, organization. How do they kind of mesh with each other?
So I do a lot of the support work for Dr. Martin. So I work with other program coordinators, and we all have different roles to kind of support this. One of the projects is CPAN, so the Child Psychiatry Access Network. That's really where I coordinate. Me and two other coordinators. We help Dr. Martin, get everything planned and done.
Yeah.
Yes, they're really great at getting a lot of stuff done. We started our projects in 2019. The Texas legislature gave an enormous amount of money to create an organization called the Texas Child Mental Health Care Consortium, of which we are a part. And it's basically the divisions of psychiatry all over the state are joined together to work on 5 different projects. The one that Naomi works on is CPAN, Child Psychiatry Access Network. And it is a support for primary care providers all over the state. They can call on any business day, call us up, and get help with finding resources for their patients. They can talk to me as a child psychiatrist or one of my colleagues about medication, diagnosis. And then when Noemi and her colleagues get a resource for a particular patient, they make sure that, let's say she's referring them for psychotherapy. So we make sure that the therapists that we give the names to the families, that they will take the insurance of the family, that they will feel comfortable treating that age of child, that they feel comfortable treating that diagnosis, because a lot of time, supposedly only 30% of people ever follow through with their mental health referral from their pediatrician or family medicine clinic all the way through actually showing up to see a mental health professional. So that means there's 70% of those kids are not following through. So we're trying to increase that rate by giving out really good referrals. Because what happens is most people, they look on the website of their insurance company and there'll be like 100 therapists. And they start calling, and one doesn't take that insurance anymore. The next 10 they call only do inpatient. The next, 25 they call. No one goes to 25. Just kidding. So we give 2 or 3 only, but we make sure that those 2 or 3 referrals are therapists or doctors, whatever the case may be, that actually can then help that patient, and they don't have too long of a waiting list. Although there's always a little bit of a waiting list. So if anyone's ever in acute distress, we just encourage them to go to the nearest emergency room, call 911. There's a lot of emergency services here in El Paso compared to a lot of even much bigger cities. So,
I mean, it sounds like together you all are trying to provide support and increase access to these services.
Yes.
Which is primarily what these individuals need, right, is the ability to be able to feel supported throughout this process of getting help. Because one thing is understanding that you need the help. Another whole different process is knowing how to get the help and then obtaining it. And I think that is, as you mentioned, Dr. Martin, is that process of where maybe people can start falling through through the cracks. And I think that leads me to wonder, based on you all's experience, what are those issues that you all can primarily see within the El Paso community that has been more prevalent that can be, that can be assessed based on the efforts that you provide?
Yeah, so the most common psychiatric problem in most communities in the United States is anxiety. There's several different anxiety disorders, but El Paso is no different in that way. We do have anxiety as the number one diagnosis. A close second is depression. And so a lot of our efforts are really focused on those two disorders. Also, ADHD is fairly prevalent. That one is, a little bit different in that we mostly do recommend medication for that disorder if it is preventing them from doing their best in school, if it's, worst case scenario, getting them in trouble. A lot of the kids that we see, we also provide clinical care, of course, in our division. And one of the projects we have is we have a contract with the Juvenile Justice Center. And so we don't ever want any of our El Paso kids to have to get all the way there, but of course sometimes they do. And so we do our best, and those kids almost always have ADHD. But the most common diagnosis is anxiety.
And, when we experienced COVID, do you see a difference in the need or maybe the type of anxiety that people experience? Has there been a shift on any of those things?
I think there's been a little bit of a shift in terms of why people are anxious. Before that, the last epidemic that really affected everyone's day-to-day life on such a broad scale was, 100 years ago there was the Spanish flu. Not that it was the Spanish flu, but everyone called it Spanish flu epidemic in 1918, 17, 18, 19, around that time. And but since then, nobody had experienced that. So I think a lot of people have shifted, of course, towards worrying about their physical health, that they're going to get sick and die, worrying about their family members. And so we always saw that somewhat. OCD patients, the obsessive compulsive disorder, that's the most common fear in that disorder is germs. But we never had the whole population worried about it. Yes. Now, I'll tell you one thing, I won't say one thing good that came out of the pandemic, but in a way it's good. Yeah. People have been so much more interested in their mental health with all the upheaval from the pandemic. So the waiting lists are a little bit longer now, I think, yes. But it's because more people are seeking care. People are realizing that your mental health is very important. I won't say it's more important than physical health, but, they're really both the same thing because it's your health. And so people are really, the stigma is going way down. People are much more interested in seeking help. Before, mental illness was a very secretive type of illness. And so that is just really not true very much anymore. It's really not... especially the younger generation, they are growing up knowing that you need to take care of your mind, and you have to have your mind at peace in order to feel good, and they're not embarrassed to say, Mom, I need to go to the therapist, or Mom, I think I need a psychiatrist. So I think that's one thing that has come out of it.
People have gotten much more comfortable about admitting these kinds of things, which is also, like Dr. Martin said, reducing the stigma. So that's really nice to see, especially with my age group. Yes. We're a lot more accepting. Mm-hmm. We promote mental health through social media, Instagram, Twitter, maybe Facebook. I don't know. Things like that. It's really nice to see. And I think, even people that are maybe a little older, they're starting to see that it's okay to, feel the way that you feel.
Yeah, so you all make really good points about, that shift. And I think it's hard. I understand, Dr. Martin, you're struggling to say something that good that came out of COVID, because it was just so unfortunate and it affected everyone's life. But I guess it is a silver lining, right? I mean,
silver lining. That's a good way to put it. That's a good way to put it.
I mean, in every situation, I think it's important for us to be able to see the things that are good, that kind of highlight, that need that before. Mm-hmm. may have been not as highlighted because we were afraid. We were afraid of being judged. We were afraid of being told that we were crazy because people, thought that if you went to a therapist or a psychiatrist, there was something wrong with you. Mm-hmm. And there's nothing wrong with, for example, a person going to the gym, but a person going to the therapist, that meant something different. Right. And so I think it's, you touched on a really good point in terms of finding that balance of one is not greater than the other, but they kind of coexist. And they do, they do coexist. And so you need to have them at par to be able to address all the things that make us live. Right. And I want to touch on the fact that when you address the work that you do, you also work with outside organizations, right?
Yeah, so I work closely with, so the coordinators and we work with other organizations in town, local LMHAs or the local mental health authorities. And because we're looking for these resources, we want to make sure that we're providing appropriate resources that are tailored to each kid that we encounter or we see through the PCP. TCHAT is similar in a way. Of course, they work with the school districts, but with CPAN, we really try to connect families with reliable resources. So a big effort for us is, doing this outreach to make sure that our resources are up to date so that it makes it easier for us and then also for the families. Mm-hmm. And that way the families can feel like they're getting, credible resources and not just, a Google search.
Yeah, and in talking about the rise of a need to seek a mental health support, what would you say are the things that you experience when working with these outside resources? Are you seeing that demand increase and, them having to deal with that, with the consequences of that?
Yeah, definitely. I think to start, the need for mental health resources is already in a pretty big demand. Mm-hmm. There's waiting lists everywhere. We try to get, the shortest waiting list, but there are certain specialties and certain therapists that only do X amount of different therapies. Mm-hmm. And I guess that's been one of our challenges is getting, people access to these resources. I don't think I answered that question.
Yeah, no, you did. You did. And I guess I was just wondering, because I think it's important to see the aspect of the need of the community, but mm-hmm. also the struggle of meeting the needs of the community. Yeah. And how is it that we can balance those things out so that we can provide that information, that support, that insight for those waiting for that support to say it's coming. Mm-hmm. Let us just work through the system. And I'm wondering from both of you, is it the need, has the need increased, and is it that there's also a shortage of mental health providers that are coming into those fields to meet the demand?
So it's that, and then also stigma going down so much, especially during the pandemic. It really just nosedived. There's so much less stigma than there was before. There's still stigma, of course, but that combined with an increased amount of especially anxiety symptoms that people are experiencing as a result of this worldwide pandemic, combined with an already identified shortage, has been it's been hard. But that's it. Our programs kind of came at a good time because a lot of them are not based on one-on-one care. They're based on models that are more efficient, such as for the Child Psychiatry Access Network. I don't talk to each individual patient because then my caseload would be full right away. I talk to primary care providers, and then each of them talks to their panel of patients whenever they present with symptoms. And so then instead of helping, let's say 50 patients a week, now I could help, 200 through this model. And then one of the things that Noemi helps me with is the education of the primary care providers as well. So they don't have to call me every time they want to start an antidepressant if I help them that with that a few times, and they feel more comfortable. And then they start going to our medical education sessions online, and then they get confident to treat their own patients on a wide variety. So it's been great seeing them become more interested in mental health, more comfortable with mental health, and because I know those kids are getting treatment so much sooner. You know, usually by the time a kid comes to see a child psychiatrist, it's been years that they've had symptoms. By the time they go to see their primary care provider, it might have only been weeks, and it's a lot easier to treat. But yeah, the workforce shortage is, you know, I don't like to think about it too much because it's pretty extreme. So any of those you want to go into mental health, we always have a job.
But you know, it's about that silver lining, right? And the opportunity to see what else can be done in order to solidify that field and those systems that work to provide that support. Obviously, we're in a space where that silver lining is still coming through. So, you know, you can't really just say, you know, it's a good thing. Obviously, it comes with its struggles. And before I delve into talking a little bit more about stigma and getting to know you personally as to why you do what you do, I want to take a step back to understand the different ways that you all approach your community. Because if I'm not mistaken, CPEN? Yes, CPEN, you all mentioned CPEN, you all mentioned TCHAT, and then you also mentioned the medical education classes. And so I just want to be able to differentiate them because I believe they provide so much to the community. So if you could talk a little bit more about those things and know how to kind of make a difference between the two and how they address the need of communities.
Yeah, so all of our programs are, I guess our big umbrella is the Texas Child Mental Healthcare Consortium, or the TCMHCC. There's a lot of acronyms in our programs. So I might just
remember them all.
I might just refer to them as their acronyms. Of course, CPAN, which we've already mentioned, we help the primary care providers, handle and care for their patients that may have mental health care needs. And then we have TCHAT, which is a school-based program and works directly with the school counselors.
Okay.
And we have the Psychiatry workforce expansion. So that's our fellowship program. And so we work with fellows to, get them hopefully to stay here in El Paso because
that's a great city.
Yes.
Yeah, that's something.
It's a great place. Yeah,
that's something that we really need here in El Paso is more child psychiatrists. Of course, psychiatrists, but even more child psychiatrists. And another initiative we have is research. So we actually have 2 studies that we do there with Texas Tech that focuses on the mental health care needs of these patients. Now, they're specifically, trauma. One of them is more based on trauma, and the other one is based on,
depression.
There we go.
And suicide.
Yes, depression and suicide, and then trauma. So we have 2 studies, and we're always looking for participants too.
You had me at trauma, as we were talking about before this episode started for the audience to know, we're just getting to know each other, right, and our interests. So I come from a background of being really interested in trauma-informed care, adverse childhood experiences, and how that affects youth development. So that's why I was research opportunities. But another thing that I think is very important is the fact that you all touch on so many different sectors. Based on the fact that you described all these programs, you touch on, the school community, you touch on primary care. Yes. I was going to say caregivers. I'm like, that's not the word. You touch on the professionals that are coming onto the field and those students. And I think it's important because we all kind of cohabitat in an ecosystem of different ways of communicating and connecting with each other. And being able to not create silos and instead being able to work with each other is so important. And I think it's very admirable that within El Paso community that is occurring.
Yeah, and one of our programs that she just mentioned, the workforce expansion, It's called, actually, the whole acronym is CPWE, Community Psychiatry Workforce Expansion. And that program is based on, not having all of our trainees only working at Texas Tech. It's based on our trainees of all levels going out into the community. And so we have relationships with Emergence Health Network, the El Paso Child Guidance Center, and Aliviane. And so what happens in those programs is our medical students, our residents, and our child psychiatry fellows, they go out into the community and they see the patients there. So they're getting, first of all, the city is getting care at all different types of clinics, but also the psychiatrists and the medical students are getting training that is really in public psychiatry. So the whole goal of that is not only we have expanded, the state of Texas has put a lot of money into this so that we can have more trainees. So we're expanding, but then also we're really focusing on public psychiatry, community mental health, and not private practice. And so we're hoping that with all these experiences that they will start to more and more stay in the public sector where we can help the people who need us the most.
Yes, I mean, we understand that those people who may come from, for example, a low-income background, they may struggle with access and may experience so many barriers. And that leads me to want to know more about what is your why? We've talked about all these amazing programs that you all cover, the help that you're providing to our community, and why y'all are doing that in the sense that there's a need. Before we started recording this, you all told me that you all are out-of-towners and that you all decided to stay. So I'd like to learn and hear you out. What is your why in terms of the work that you do? And why here in El Paso?
Oh, I love El Paso. I lived here. I was transferred here when I was in the Army as an Army psychiatrist. And, I thought, oh, this is my last duty station. Then I'm going to go home to California. And, oh, my gosh, 2 weeks afterward, I just loved it. I just love the weather. I love the people. It's just a nice, calming place to live. And, of course, my why in terms of why did I go into psychiatry started years ago. And I knew that I wanted to go into the medical field because I wanted to hopefully help people have better lives. And, your third year of medical school, you do all these different rotations trying to decide, like, okay, how exactly do I want to help? And it was kind of the same experience as when I moved to El Paso. I'm like, oh my gosh, I love this place. My first day on the psychiatry rotation, I was like, wow, this is where I belong. And so I just felt comfortable. I was just fascinated with the work, with the brain, with the mind. And I have never regretted it for 1 minute. So all those many years of training were totally worth it because I really enjoy my work. I really love all these new programs. We're coming up with new programs all the time, adding to, we have state initiatives, but we get to kind of add our own El Paso spin onto it and to try and provide as much care in the community as we can.
Thank you, Dr. Martin. We're lucky to have you. Appreciate that you stayed.
Thanks. That's another thing. People in El Paso really appreciate us. It's all over. Everywhere I go, people are like, oh, thank you so much. And my own patients, they're just so sweet to me. And people do appreciate help here in this town.
Yeah, people are very nice here. That's also a part of the reason why I also stayed. Like for me, I moved down from a big city, from Denver, Colorado. And it's just a different pace here. Everything's a lot more quiet, for sure, less traffic. But a big part of why I chose to do this was because it's a very new thing. Like Dr. Martin said, this started back in 2019, early 2020. And these programs are very new, so it's exciting to see what kind of challenges you'll run into. I like working with new programs where you have to kind of like put your own El Paso spin on things, to make things work. all of our programs, they're found throughout the entire state, but we cover a 16-county region. A lot of it is rural, so it's really nice to be able to, see how these rural areas, in West Texas, in the Wild West.
Yeah, we just went to We just went to Monahans on Tuesday. Monahans and Fort Stockton and Van Horn.
Oh, okay.
So the part of our outreach is we go and visit both schools and primary care offices all over our region of Texas. And we always have fun.
It's a lot of fun. It might be a little bit of driving. That's
a lot of driving.
Yes, you
Noemi was our driver this time.
You do live in Texas, so everywhere you have to drive.
It is a big state.
That is one ginormous state.
That is one thing I've came to learn is what a big state. It's amazing.
We're also lucky to have you, Noemi. So appreciate you staying and providing that help. And before we end, I'd like to touch on 2 last questions. You all talked about, that El Paso spin and that mental health shift that has happened. Can you talk about it? What do you mean when you say we need to, you all have had to do that El Paso spin to your programmings and that shift in that mental health stigma?
Oh, goodness.
Well, I think I could probably start here and then Dr. Martin can
Yes, go ahead.
But so what we do here is what 11 other schools do throughout Texas. But a lot of them are out east. So like Austin, Houston, Dallas, San Antonio. They're all known. And, some people sometimes forget that El Paso exists or that it's even a Texan city. Yes. So by kind of putting ourselves on the map, that's kind of what we mean by our El Paso spin. So a lot of the way that we even present ourselves, we try to, not seem like we're part of the same program as Austin per se. Nothing against Austin or anything, but that's our capital. Everyone knows the capital. So we want to identify El Paso as its own thing, and this is what we're doing.
And we really appreciate it. What about you, Dr. Martin? What would be your take?
I think one of the things that we've tried to do, and hopefully we've been mostly successful, is when we try to connect with people one-on-one. So we do have webinars, but then we also go into the community every week, at least once a week, whether we drive all the way to Eagle Pass or we just drive to the east side or the northwest. We make sure that we are always going out into the community so that people know us and trust us. We're not some people that are, trying to force a program on them, that we're actually just regular people and we have certain skills that we want to share. And if they know us and we're friendly, we're hoping that they will let us help them.
Yes.
And I think it's really working. Some people that I can just, with CPAN specifically, that's where I do most of my work. I can see the primary care providers, starting with something more on the basic side, and then as they get more comfortable, they're doing more and more complex things. They're not just sending everybody to a psychiatrist, which means you're going to be on a waiting list for a long time. No, they're willing to start right away. And, when we call them up and say, oh, we're going to be in your town today, they're like, oh, that's great, you should stop by. And so we've just gotten a warm welcome as we've gotten to know everyone. So really the one-on-one outreach is kind of what we're known for amongst our partners all over the state.
Well, and I think that highlights the fact that you know your community, because El Paso is a very tight-knit community. And if you present yourself as a person who was to genuinely help, but you do so by connecting with them, that one-to-one interaction, it is very appreciated because you want to be able to build that honest and authentic relationship with the people that you're helping. So I think you touched on a really good a really important value in El Paso, which is that connectedness, transparency, respect, and loyalty, right, to one another. And the fact that you also highlighted, Noemi, the fact that El Paso is sometimes forgotten. And as a community, we sometimes do feel that. And the fact that you as people who came out of El Paso and decided to stay highlights the fact that El Paso is great. And we really are appreciative of the help that everyone provides. And I think it's definitely something that it goes a long way. And y'all are doing amazing work. I say it again, thank you so much. And before we leave, is there anything that you all would like to talk to the audience about? Any announcements, any upcoming events that you all would like for them to know?
Yeah, so we host continuing medical education series. Our last one is next month on the 11th. One of our own fellows will be presenting a topic. So just watch out for all of that. If you guys are interested, you guys are more than welcome to reach out to any of us. And also, we're always employing people. We're always looking for
always
people.
hiring.
We're always hiring.
We want to expand, keep expanding,
Yes.
but really what is limiting our expansion and limiting how much care the people of El Paso can get, the children, and especially the children and adolescents of El Paso can get, is how many therapists we have. And so we are always hiring therapists. We also are always hiring administrative people like Noemi. We have one more CPAN position for program coordinator that's going to be opening soon. So if people want to hear about either our educational offerings or our projects or who we're hiring, then just get on the Google.
Yes.
Just type it up.
Texas Tech. Remember, it's Texas Tech El Paso, though. Yes. Texas Tech El Paso. And then we are the division of telepsychiatry in terms of our website and our jobs. So telepsychiatry jobs, Texas Tech El Paso, and you'll see all the things we're hiring for, which is a lot.
Okay, thank you. Appreciate it. So for them, if they want to know about, like, for example, the classes, should they email you? Would you be able to provide an email, or whose information with
so
you?
they can email me. I go ahead and coordinate that. Also, our social media is a really good resource. I post everything there on the social media.
Telepsychiatry.
Yeah, telepsychiatry. It's El Paso _telepsychiatry on Instagram.
Oh, nice. Okay.
And then we also have a Facebook page.
Okay, and for the audience, you all are also welcome to put any comments in the postings that we have for the podcast if you're interested, and we're more than happy to then connect you all to these wonderful individuals. But for now, this is the end, and I want to again thank you all so much for your time. I had a great time learning from you, hearing that you all love El Paso so much. We should have worn We Love El Paso shirts for this for this episode. And for the audience, thank you all so much for listening to us. We look forward to the next episode. Until next time. Bye.
Thank you.
Yeah.